Excellent. Good afternoon, everyone. My name is Ashley Cruz, and I'm the Events and Engagement Officer here at the Mental Health Foundation. Before we begin, we'd like to acknowledge that what we call Alberta is the traditional and ancestral territory of many First Nations, Métis, and Inuit, who for generations have lived on and cared for these lands. Our work takes place on the historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and a portion of the Métis homeland, including Regions 1 through 6. Since we're in a virtual environment today and we have people joining us from all over the continent, from what I can see in the chat, I'd also like to acknowledge that no matter where you're tuning in from, we offer respect and gratitude for the land and all of those who live on it. We're really excited for today's session, which will focus on ways to support mental health in everyday interactions. Our hope is that you walk away with actionable takeaways that you can start using at work, at home, and everywhere in between. At the end, we'll be sharing the link for our next Lunch and Learn session in October, as well as a short 5-question survey. So be sure to stick around until the end. Now, I'm pleased to turn it over to our platinum sponsor, Ellis Dawn, who we're thrilled to have as our presenting partner for our entire 2024 Lunch and Learn series. We all know it's our dedicated partners like Ellis Dawn who truly make these events possible. So, Sharina, I will pass it over to you.
Thank you, Ashley. Thank you for having us today. And on behalf of Elliston, we are honored that we can be a part of your Lunch and Learn Mental Health series. And so good morning or good afternoon, wherever you are. As Ashley mentioned, my name is Sharina Ramos, and I work for Elliston as a proposal coordinator. Just as a quick intro to Elliston, we're an employee-owned Canadian construction services company that brings in over about $6 billion in revenue annually, and we have about 5,000 employees, including internationally, and about 500 of us here in Alberta. Personally, I am very happy to be a part of a company that is employee-centered and actually cares about our mental health and well-being. Elliston has a number of mental health initiatives, as you may know. We hired our first mental health specialist, who is Nadina Holta, who you may know from the previous Lunch and Learn. She supports all our divisions within the company, and she also helps and guides our employees to seek support if they need it. We also have our mental health and wellness support microsite, where all our employees can access multitudes of resources in terms of mental health. And locally, our management supports foundations such as the Mental Health Foundation and this series as well. So I'm glad that through these programs, we get to spread mental health awareness and encourage everyone to take advantage of these resources to prioritize our mental health. And so without further ado, let me introduce you to today's Lunch and Learn presenters, Anissa and Kathy. They are health promotion facilitators with Alberta Health Services Professional Practice and Education Services in the Edmonton Zone. Anissa Gill is a registered social worker supporting adults and older adults who face mental health and addiction challenges in their lives. Anissa is also a sessional instructor at McEwan University in the social work program. And Kathy Mercier brings experience in providing community support and psychoeducational materials to children, youth, adults, and families in the areas of mental health addictions. So without further ado, I'll pass it on to Anissa and Kathy. Thank you.
Thank you, Sharina. Just give me one moment. Pardon me. Sorry, I kind of made a mistake here. Just bear with. Okay. So, we're again excited to have you here today over this lunch hour. And this is our virtual session, Journey Together, Ways to Support Mental Health and Everyday Interactions. This session is brought to you through Alberta Health Services / Recovery Alberta. We're making the transition over the summer. And we're part of the Professional Practice and Education Services team in the Edmonton Zone. And this presentation is in partnership with the Mental Health Foundation and Elliston. And as Sharina was saying, my name is Anise, and I'm a health promotion facilitator with a team. And I will be presenting the first half, and Kathy will be presenting the second half of our session this afternoon, this lunch hour. Okay. So, as we know, our mental health is an important part of our overall health and wellness. However, every year, 20% of Canadians experience significant mental health problems. And someone we know may be struggling with any mental health and or addiction issues. We may struggle in terms of offering support and care. We may not know what that look like. So, in this
Anissa,
session, yeah.
I'm sorry to interrupt. Your slide hasn't advanced.
Oh my goodness, sorry, I'm having a little bit of issues here. Goodness gracious. Okay, here we go. Maybe this will help. Um, go. Okay, here we go. Sorry about that. I was just having some delayed slide feedback here, but here we go. So this information is designed for educational purposes only. Thank you, Kathy, for catching that. And it should not be used in place of medical advice, instructions, or treatment. So if you have any specific questions, please contact your doctor or healthcare professional. In today's session, this lunch hour, we'll be taking a look at what mental health is and the stigma that often is found around having mental health challenges. We'll discuss possible signs of mental distress that we may experience or see in others. And then most of our time, we will be around discussing some tips for supporting wellness in others and ourselves. And then Kathy will be going through what that looks like. So with that, you may want to grab a pen and paper to write anything that you may find helpful, as well as some of the information we'll have at the end around resources to further your awareness and learning. So let's start by considering what mental health is. So the World Health Organization defines mental health as a state of mental well-being that enables us to cope with stresses of life, realize our abilities, learn well and work well, and contribute to our community. We often think of our mental health as something separate from our physical health, but of course, these always work together. And as a reminder, there is no health without mental health. So a question for everybody, please feel free to share your answers in the chat. If you have diagnosed mental illness, you cannot have mental wellness. So if you have a diagnosed mental illness, you cannot have a mental wellness. True or false? Feel free to share your answers in the chat. Yeah, they're coming in quick and heavy. These are fast. Give it a few more seconds. All right, so let's take a look at what the answer is. So the answer is false. So let's look at this a bit more. So in this chart, mental health, the vertical line, falls on a separate continuum than the symptoms of mental illness, which is on the horizontal line. Just as other health issues such as diabetes or asthma, while serious, can usually be managed, allowing people to live. People who have received the diagnosis of mental disorders can have good mental health with good assessment, treatment, and management. It's also possible to have poor mental health without a diagnosed mental illness. So, with the right supports, evidence-based treatments, and complementary strategies, all people, including those with mental illness, may find they're able to live well and find meaning, contribute to their communities, and work towards their goals. So here's another helpful way of seeing the relationship between mental health and mental illness. This diagram shows the difference in terms of interrelated levels of mental health. We have no distress. So at the bottom of the pyramid, and it's the widest category, we see the mental state that hopefully most of us reside in most of the time, which is no distress. So in this state, we may be regulated, open, and able to take on what the day has in store. This is universal, and we all experience times of no distress. Next up on the pyramid, right, we see that mental distress. So this is the brain's expected and usual increased response to the stresses of everyday life, such as exams and relationships and job stresses and disappointments. So this is also universal. It happens to everyone at some point, even every day. So this is the type of stress that can get us going or gets us focused and motivated. It's often seen as negative, but really is helpful and necessary for adaptation, learning, and coping. So everyday stress does not need treatment as it's a short-term response, and the body is usually able to return to a state of no distress relatively quickly. And then we sometimes face mental health problem, also something we'll experience from time to time in the course of our lives. This is the brain's response to a severe or persistent life problem, such as a death of a family member, severe bullying, parental divorce, or just burnout. This too is universal and happens to everyone at different times in their lives. So, with mental health problems, adaptation can be difficult, and these challenges may require our attention, often our additional time and support, such as taking time off of work to see a counselor or therapist. However, it doesn't usually require formal treatment. And at the very top of the pyramid, we have mental disorder or illness. This is the smallest category because it does not affect everyone. So, with mental disorder or illness, the brain is not functioning in a typical way, leading to significant and persistent problems in a person's everyday life, caused by a combination of genetic and environmental factors. This is not universal. Not everyone is given a mental health diagnosis over their lifetime, but for those who do have mental disorders, these are diagnosed and supported by a trained health clinician using evidence-based and scientifically valid assessments and treatments. Okay, so mental health and substance use problems are common. And in any given year, 1 in 5 Canadians, so that 20% I was talking a little bit earlier on, experiences mental health problems. By the time Canadians reach the age of 40, 1 in 2 have experienced a mental health problem. So annually, around 5 million Canadians, about 1 in 7 or 14%, use health services for mental health problems. So that said, there are others that do not reach out for help or don't even know where to get that help. And there are those that don't reach out for help because of they have experienced stigma. And maybe you've experienced stigma. So stigma is when you've had that negative attitude or belief or judgment of another person because of who they are or something they are experiencing. So in this cartoon that you see on the screen, we see someone who's having a physical health challenge being told, well, why don't you just try harder? As if their broken bones can get better with a little bit more effort. Of course, most people wouldn't expect this with such a physical challenge, but somehow with mental health challenges, we sometimes expect this. So in mental health, stigma is the negative attitudes and beliefs about people with mental health issues. They might be thought of or labeled as weak, unreliable, beyond help, manipulative, or attention seeking, or incompetent. Sometimes stigma leads others to think that mental health problems are the person's fault, an excuse, the result of a choice, just laziness, or are something you can't just snap out of it. Just snap out of it. But mental illness is not a character defect, right? It's a health problem. And I'm going to say that again. But mental illness is not a character defect. It is defect rather, it's a health problem. So let's watch a video that talks about stigma around mental health from people who have experienced it. And just a bit of a warning, beware that in this video, suicide is mentioned. So if you need to step away or put it on mute, feel free to do so. But we will just be looking at this video of stigma around mental illness. Here we go.
Hello, my name is Henry Boyd Jenkins. I have a diagnosis of schizophrenia.
I had depression. I had a miserable, horrible life for many years.
I also happen to have been diagnosed bipolar 1 disorder. I'm also someone who suffers from chronic schizophrenia.
I suffer from borderline personality disorder.
Major depression and anxiety.
I live with bipolar disorder.
My dad suffered from depression and anxiety.
My sister has bipolar disorder, and my nephew has schizophrenia.
Mental illness strikes with a two-edged sword. On one side are the symptoms and distress and disability.
My dad committed suicide because of those feelings of anxiety and depression.
So I went from practicing law on that Friday to being in bed for a number of months.
On the other side, though, is community's reaction to illness, the prejudice and discrimination that makes up stigma.
Stigma happens because they're members of a group that are feared, despised, loathed.
Stigma sucks.
Stigma has impacted my own confidence.
I just thought I was abandoned, ignored by people. I've come to learn that it's a very common occurrence with people with mental illness.
The stigma, the version of what it is to be mentally ill, has cost me 2 of my siblings out of 3.
It's woven into the fabric of our society, and it stems back centuries, really, when mental illness was considered a character flaw.
There's such a bad stigma attached with having a mental illness or showing a symptom of it, and it's just not okay. Not in the high schools, not at all, actually.
Every life is touched by mental illness.
It doesn't matter if you're black, you're white, you're a man, you're a woman, you're young, you're old. It affects all of us.
In very personal ways.
People who have a mental illness are excluded and treated unfairly. And this is because people are afraid of mental illness.
In the long run, stigma produces a kind of isolation that grows from fear.
As a kid, my dad would vanish into the ether. No one said anything. I learned later, no one was allowed to say anything.
Silence helps perpetuate the stigma surrounding mental health and suicide.
The conversation simply needs to start.
When we just open up the conversation and begin speaking about it, it's amazing what can happen.
It's okay to talk about it.
Talk to others.
Talk about these things. Talk out loud without fear.
Because as long as stigma exists, it prevents the society as a whole from incorporating these illnesses into a dialogue.
With advocacy, we can help educate, inspire, and inform people.
Yeah. And so that video, as one of the, person who's presenting mentioned that mental health can happen to anybody, right? Regardless of age, gender, racial background, socioeconomic status, right? It exists, it's there, along with that stigma. And when people are facing that stigma, it highlights that fear and isolation and feeling abandoned by the community at large. Right? And again, having that conversation, right? Highlighting and illustrating the importance of why mental health is an issue and where to get help, right? So we can fight that stigma. So I enjoy that video very much because, again, it just takes a look at how a number of people across our lives and across our population really struggle with mental health. Okay. So stigma spreads, again, false ideas about mental illness, making it harder for those affected to get the support they need. So reducing stigma involves gaining understanding about mental illness, like we're doing today, raising awareness, and showing empathy so that we can be more supportive with those who are experiencing mental health challenges, including ourselves. So as we mentioned already, mental distress is something we can experience every day. So we can notice it in ourselves, but we can also become more aware of it in others by watching for possible signs. So as we talk about mental distress and mental health problems, we're not going to be discussing any specific disorders such as the ones on the screen, just to name a few. If you or loved ones have been diagnosed with specific mental illness, we do encourage you to learn more about it, and we will give you some resources at the end of the session that can help you to do so. So again, wherever someone is at with their mental health, we want to acknowledge that we all have hard times, right? Sometimes in our lives. In our everyday interactions with those we live or work with, there may be times that we notice that someone is experiencing some struggles and issues. Maybe we can observe changes in their expressions, behaviors, or routines. Maybe they're saying things that indicate they may be having a problem, or just feeling sad or anxious or just experiencing emotional distress. So the signs of mental health challenges can be very pronounced, but they can also be very subtle. So with that, I am curious, you want to know, what are some signs that you might notice in yourselves or someone else that might be experiencing mental distress or mental health problems? Feel free to share your answers in the chat. I'm curious to see what that looks like. Okay, withdrawal. Yes. Headaches, change in appetite. Absolutely, right? Some of those physical symptoms that we're seeing. Shortness in breath, insomnia. Yes, yeah. Or sleeping too much. So lack of sleep or sleeping too much. Short fuse, so they may lose their temper very quickly. Lack of self-care, so they're not taking care of their hygiene, they're not eating well. Change in personality, right? So you're seeing some swings from their usual, how they usually are. Nervousness. Yes, yes. Not focusing on any task. So you're losing some of that concentration. Crying easily. Yeah, so something might trigger you to cry a little bit more. Yeah, gotcha. Anger, that's a big one, right? That's something to highlight. All of a sudden, somebody's getting very angry, or they're just getting a little short with everyone. Nonstop talking. Yes. So someone who may be a little bit quiet or maybe sort of talks regularly, and all of a sudden they're just chatting a lot more, and maybe they're saying something in their talk or speech, right? So being aware of what's changed, right? Are they suggesting something, or are they focusing on a certain topic that might be of concern? So something to be aware of. Absolutely, yes. The good old GI, right? Your stomach issues, or you're kind of considering issues with your gastrointestinal system. So you've seen a change in that, right? And so there's a lot of research that's showing that the connection between your GI health and your mental health there is a relationship. Chronic illness. Yes, right. So you're just experiencing all aches and pains in your body. Some of them can be explained, some of them cannot. And certainly we can appreciate that relationship. Perfect. So as you can see on this screen, there's a variety of signs that we can see in ourselves and the people that we care about in our lives, right? Our coworkers, our family members. And so just to be aware of what that might look like, right? Sometimes we could just name it as that sort of change from that baseline or change from their usual self. Right? So keeping that aware of what that looks like. So thanks everyone for sharing. We hope that was helpful. So there are many physical, those, like you mentioned, the emotional, cognitive, behavioral signs and symptoms that may be present in someone experiencing mental health challenges. So one or two of these symptoms alone can't predict a mental illness, but may indicate a need for rather further evaluation. So if a person is experiencing several at one time and the symptoms are causing serious problems in terms of their ability to study or work or relate to others, this may need the support of a physician or a mental health professional. So people with active suicidal thoughts or intent or thoughts of harming others may require immediate support. So when you look at these signs and symptoms, it can sometimes be tempting to attach these to mental illness diagnosis. So we might think, I think she has anxiety, or he's so OCD, OCD standing for obsessive compulsive disorder, or naming the behavior as that's bipolar for sure. Right? So while we sometimes think these labels bring clarity, they can actually increase stigma. So where we view others as a diagnosis or disorder and not as a person. So we can't diagnose, and we may be very incorrect in our understanding of the signs we see and their causes. So something else to consider is if we see some of these signs that you see on the screen, whether in someone else or yourself, some of these symptoms can be caused by physical ailments such as anemia, pregnancy, thyroid issues, just to name a few. So let's not try to make assumptions about what we're seeing. Again, we all may experience these things on occasion, and just the presence of them does not necessarily indicate a problem that requires further support. However, these signs or symptoms might become a problem if they reflect a significant change from a person's typical or usual level of functioning. So maybe the frequency of these signs is increasing. Maybe the intensity of the feelings is increasing. Maybe the duration is increasing, or maybe it's starting, which can negatively impact the multiple areas of a person's life, such as work, school, hygiene, finances, or relationships. So with that, I'm going to pass it over to Kathy to talk about how we can support these mental health challenges if someone in your life is experiencing them, and what strategies and tools can be used to support yourself or others to help them with their mental health journey. Thanks, everyone.
Thanks so much. So when we do notice or have a concern about someone else's wellness, what can we do? How can we support another person's mental health? And so before we get into these tips, we just want to point out that you don't have to know everything about mental health or every sort of mental health problem. And you also don't have to have a perfect relationship with another person before you can offer some support. We're all human. And so we got to acknowledge that conversations around offering help or even needing help, these can be awkward. And yeah, it's going to feel unnatural at times. That's okay. It's still worth it to check in with those that we care about. And that's kind of our first, there we go. First kind of tip is, well, we've actually, before we check in with others, we want to kind of check in with ourselves. If you think you want to talk to somebody about how they're doing, how are you feeling about that? What are your hopes for the conversation? What are your hopes for the other person? What are your worries? What are your assumptions? I want to ask you a question, and maybe you could just share in the chat. What may be some hesitations that we might have around supporting someone that we see as struggling? So we see someone, they look to be having some challenges for whatever reason. Maybe we saw some of those signs, but we might not know kind of how to approach this. What might be some hesitations that we have? Maybe you've had some hesitations. So some people are worried that they're not saying the right thing, or they might say the wrong thing. Absolutely. Being nervous to say the wrong things and making it worse. Or somebody said, being nervous to say the wrong things and triggering an awful reaction, right? Maybe we're worried that someone's going to lash out at us. Or maybe we think we're not capable of helping. Or we think that, like, I like these points. Yeah, asking about something might shut the person down. Exasperate the issue. Yeah. You know, we just feel awkward in bringing it up. Or we're worried we're going to be pushed away. Exactly. I think we can all relate to these things. Thank you so much for sharing, everybody. Not being able to provide adequate support. Somebody else said we also might open or trigger our own traumas, own experiences we've had might come to light, our own feelings, our own hurts, all that might surface. Maybe we won't have the right solutions. Maybe we feel obligated to be part of the solution. And again, these are all things that I think we all can relate to. For sure, you know, sometimes we feel reluctant to help people because we are afraid we're going to do the wrong thing. We're going to make the situation worse, or we're going to find ourselves in a situation where we don't feel resourced or equipped enough to be able to kind of manage what comes our way. It's really important to, when we do notice that there's someone who might need some help, that we acknowledge their signs anyways, and still try to have some compassionate conversations. But it is important to check in with ourselves and how we feel, and any hesitations or concerns we have going in. Because we need to take care of ourselves through this too, also to be helpful to other people. Thanks everybody so much for sharing. So let's see, did I miss something here in the chat? Yeah, somebody put, am I overstepping boundaries? Did I misinterpret someone's actions? Absolutely. You can wonder those things. Just being aware of some of those feelings that we might have, our own needs, our own energy, our own boundaries, our own judgments, our own expectations. These can help us to be more prepared to have these meaningful conversations with others. When we have this kind of in the moment awareness, it allows us to better take care of our own needs, manage our expectations, and keep an open mind. It helps us to communicate more clearly and to be fully present and attentive. So whenever we plan on starting a conversation or approaching someone just to check in, it might be, helpful to first just check in with ourselves, take that moment to calm. Maybe we need to take a few deep breaths beforehand so we can feel more centered and more regulated. So let's say now we're not feeling perfect, we're not feeling completely ready for anything, but we are feeling a little more grounded and ready to maybe approach the conversation, to just check in with the other person. What are some things we might want to consider before we do that? Some things we want to wonder about, consider who you're speaking with, what you'll say, when do you plan on speaking with them, where could the conversation take place? Should it be in private? Should it be in public with other people nearby? Thinking about everybody's wellness through that. Think about why you're wanting to have that conversation. We're just going to look at a couple of these questions more closely. When we're thinking about who we're going to speak with, we can also consider, is there anyone else who should be present or informed about this conversation? So if we're planning to have a conversation with a child or an adolescent, or with a person who might not have the capacity to make their own care decisions, we may need to let others know of our concerns, or we might need to involve others in providing supports prior to or after our conversation. Or if in our conversation, we do learn about someone's thoughts of killing themselves or harming others, then we'll have to tell others about it to enhance everyone's safety. So in situations when we're having conversations about wellness and mental health, we can't promise the person that we won't tell anybody else, because we may need to do so for their safety or other safety because we care. And we can communicate that it's because we care. We're thinking about what we plan to say. If you're not sure how to approach the situation, it can be helpful to kind of prepare your words ahead of time and even practice saying them. We can think of a couple conversation starters. Hey, how you doing? Something seems different lately. How are you holding up? I noticed something today that made me want to talk with you. It's been a rough day. How's everything going? Just checking in. Is everything okay? Or we could even take the time, if we really want to just make sure we know what we want to communicate, we could write out full scripts just to help us prepare. I just wanted to check in with you because I noticed that you've been a bit quieter and more tired than usual over the last couple of weeks, and not hanging out in the living room as much as you usually do. And I've also noticed that some things seem to be bothering you more than usual. Like today, when the dog jumped up on you, you really yelled at her. And when I asked about your weekend plans, you seemed irritated with me. It feels kind of awkward to bring this up, but you're really important to me, and I want you to be well. How have you been feeling lately? So we can prepare this ahead of time if that's helpful to us. We don't have to read this to the other person, but it can help us to better understand, what we've noticed and build up some more key points of care. And then we can think about when to have the conversation. If you're concerned about another person, but maybe safety isn't a concern, you might want to have a wellness conversation when everyone's rested, when everyone's fed, when everyone has the time or the space to share freely. That said, I know sometimes we want to wait for that perfect time to have impactful conversations, but usually there's no perfect time. But usually you can find a good time or a better time. Also remember, having conversations around how people are doing around their wellness isn't a one and done type of thing. Hopefully this is just one part of many helpful conversations over time. Now, if you are feeling concerned about the other person's safety, or if you're unsure about it, a conversation with that person might need to happen now. So for more information on how to support someone who may be having thoughts, or they might have behaviors around suicide, you can actually call the National Suicide Helpline. That's just dial 988 and it'll put you through, or you can go to 988.ca for more information. And of course, whenever someone has a serious or life-threatening emergency, call 911. When having conversations, we might come with preconceived ideas about what's going on for that other person. Or maybe we even sometimes think that we know what's best for the other person. So when that's kind of happening for you, it's really important that we take another breath and turn ourselves towards listening to the other person without judgment. And this involves things like accepting the other person where they are, wherever they're at, or allowing the other person to talk. We're not going to try to, interrupt them. We're not going to try to fix all their problems. We're not trying to fix them. And we also want to just allow for some time. And there might be some moments of silence. There might be some pauses, and that's okay. We want to just create that space where we can listen without judgment. And if we are unclear about something that the person has said when we're talking with them, we don't understand something about their experience, we can show curiosity and we can ask open-ended questions. So we can share reflections and summaries about what we've heard just to make sure that we've understood correctly. And we can also pay attention to any body language, any tone of voice, any facial expressions in the other person that really communicate beyond just what's being said. So I have a question for you. Whoops, let me just see if this will move here. How can you tell when someone is really listening to what you have to say? What do you think? What are some things that help you to know that someone's really listening to you? So we've got, they engage. Yeah. They might have eye contact. Yeah, that's coming through. Eye contact, eye contact, eye contact. They ask for clarifications, right? They show they're really paying attention. They want to get it right. They want to understand. Anything else that we see in people that we can tell they're really listening to what I have to say? Their body language. What kind of body language might they have? They could put the phone down. Exactly. They're asking some, questions to show their interest, just telling their interactions. They're not interrupting all the time. Yeah. So they're present with you, right? They lean into the conversation. So again, with the body language, even maybe it's a physical lean in. They come to your level. They match your energy. Yeah. So they're not like listening, keeping an eye out for what's on the TV. They're really showing you that they're fully present, and they are showing through their verbal cues, whether that be through some questions, whether that be through little prompts like, uh-huh. They're listening and they're not interrupting, and they're giving you that eye contact. They're showing you, I'm here, right? No phone, no distractions. I'm listening to you. Thanks everybody for sharing those, right? We know what it feels like when people really listen to us. It has been said that you hear a siren, but you listen to music. It's such a great feeling when those we care about are really listening to what we have to say, our feelings, our challenges, our goals. So let's keep all this in mind and check in with ourselves and what we're communicating when we're engaging in caring conversations. Sometimes when we engage in conversations, again, we worry that we won't know what to say in response to the other person. Maybe it's because we don't feel confident in our words, or maybe we haven't actually experienced what the other person has experienced. Again, that's okay. We don't have to have all the right words. We don't have to have shared every experience that the other person has experienced. But what we can do is still acknowledge their situation and acknowledge their emotions around it. And we do this with validation. Validation means letting someone know that their feelings and their thoughts and their views are important and valid. When you validate someone, you're showing them that you care about what they're going through and that their feelings are real and that they matter. Even if you don't quite understand why a person is feeling a certain way, or maybe you might not feel those same feelings or have that same interpretation of that situation, or maybe you don't even completely agree with the other person's perspectives, you can still acknowledge that they're having those thoughts and those feelings and emotions. We can't tell other people what they should or should not feel. Everyone's allowed to have their feelings. And so one thing we do want to say about that is it's important to understand that we validate feelings, but it's also okay to say not all actions are okay. We don't have to validate harmful or inappropriate behaviors. So here are some simple statements of validation that we can say to others. Your feelings are important. It's okay to feel overwhelmed. It's understandable that you feel this way. Your feelings matter. These statements may not seem like much right, here, but simple statements like these can go a long way in helping other people feel heard. And here's some other examples of things we might hear and some statements that could validate, normalize, or empathize with a person's experience. We could hear someone say, "I don't feel anything at all." One response might be, "Yeah, sometimes this happens, or we just feel numb. I want to support you to find ways to start feeling better again." Maybe we'd hear something like, "No one really cares for me, not even you." This might be hard to hear, and we may need to take a breath before responding. But our response could be as simple as reflecting this back, "You don't feel like anyone cares for you, and that I don't even care about you." Or we could even try to identify some emotions that might be underlying what's being said. "You don't feel that others care. It's understandable that you feel alone." So I have a question. Let's put some thoughts in the chat. Again, there's so many different ways we could respond with care to different statements that people might say. Can you think of some simple caring words that you could offer to this statement? "I feel pulled in so many directions and I don't know what people want from me." Share your thoughts in the chat. Anything come to mind? What could we say? Something simple to someone who says, "I feel pulled in so many directions and I don't know what people want from me." That must not feel good. I bet that can be difficult. Yeah, just simply acknowledging that person's experience. Yeah. It's okay not to be okay. And that's okay to say so. Yeah, I'm proud of you for acknowledging your feelings. Yeah, that's a heavy burden. It seems like a lot right now, for sure. And "let me help," or "how can I help? Is there anything I can do that will help you in this?" For sure, you can definitely offer that. Thanks everybody for sharing your thoughts around this. Again, there's so many different ways we could respond, but it can be helpful to think about what our responses are so we can make sure that we're still not trying to take over, not trying to fix, not making it about us, but trying to validate and honor someone else's experience. Another example of something we could say would be, "It can be overwhelming when you feel pressured and unsure." Again, we can think of statements like this that can help to show that we care. And when someone shares with us that they're experiencing a mental health problem, they may already be aware of or engaged with helpful resources in the community, but they might not be. So when you're talking with people about maybe what some next steps might be of where they could get some help, you can first learn more about any resources they're already familiar with, because they, again, might already be connected. Or you can ask them what types of support have been helpful to you in the past. Or you can ask them, would you like any additional resources? But some people say, "No, I'm good, thanks. I just needed to talk about this." So it's our hope that in our conversations around mental health, our conversations will kind of lead to seeing if there's any other supports that are needed. And if there are, then helping a person to be connected to some effective community supports that can reduce the symptoms of mental health problems or increase resilience and overall wellness. So besides connecting people to helpful addiction or mental health services, which is still important, and there's many services that we can access, we also want to consider what are other things that could help someone in a situation that might be available to consider. So we might want to consider housing or shelter supports, financial supports, emergency food or food security supports, primary care centers, family doctors, 2S LGBTQ plus supports, Indigenous supports, disability services, programs for newcomers, programs for seniors, parenting supports, recreation programs, family violence supports, employment and education supports, and there's so many more things we can consider. When we're thinking about the supports that a person might need towards their overall wellness, we need to think of them holistically and all the things that could impact their wellness. And there are supports out there. You know, one of the challenges that comes with trying to connect to resources is that resources can often change. Programs can come and go, or maybe the ability to access a program might really depend on that program's location, or is there a cost involved, or there are eligibility requirements. And so thankfully, though, anyone in Canada can pick up the phone and dial 211 to reach a service navigator who's got some current information on community-based health, social, government services such as these, or some things that are near or in their community. So if you want to help someone to find more supports, or that you know somebody who's looking for some more supports, 211 is just a great, easy number to remember to be connected to a specialist that can help you to navigate and find some supports in your community. We should also acknowledge that even when resources are available, finding the right supports, it can still take a lot of time and effort. So we recognize that sometimes we're in a marathon and not in a sprint, but it's still a process that's worth it to do. Also, we want to acknowledge that supports don't just have to be formal supports from a health professional or a community support. It can also be things like helping someone to remember and strengthen their relationships with supportive family or friends or even pets. All of those things can support our wellness. We can also talk with a person about any barriers they might have to accessing supports. Do they have transportation issues? Are there financial barriers? And maybe we can talk through them to do some problem solving. There might be some ways we can help them to think about how they can address these limitations. And then also we can sometimes, assist the other person in accessing different supports. We can even advocate on their behalf if this is something that they want or something they feel is helpful. Throughout this whole process, when we're supporting someone else in their wellness, it's really important to respect their choice and their autonomy because they are the experts in their own life. And you are the expert in yours. So the last point we want you to consider is when you're supporting the wellnesses of others, you need to take some time to support your own wellness. It's really important for you to regularly engage in activities and practices that reduce stress or help you feel more satisfied, more rejuvenated, and more connected. Self-care not only helps you to adapt to changes and better recover from setbacks that life may throw your way, it's also necessary for you to be effective when you're supporting other people. As we say, you cannot pour from an empty pot. And so when we are filled, we have more things to give to other people. As we think about caring for ourselves, we don't have to come up with anything too fancy. Even just tending to our most basic needs is the best place to start. So we're going to watch a short video. This was made during the pandemic, but the messages here still apply to us today as we consider the stressors in our own lives and what we might feel right now about the world at large. So let's take a look.
Today we're going to be talking about showing up for yourself. So when there's a lot going on in our lives, in the world, when it feels as though there's just no more space in our mind, it's really tempting to let go of the things that are most important to us and the things that are going to keep us healthy and well. And now more than ever, it's really important that we focus on those things that are going to keep us healthy and well. So as much as possible, if you can, find a time to meditate. Find a time to step out of the thinking mind, to rest the thinking mind and just be present. Make sure you're taking time to exercise if you can. Most of the gyms are closed down. It might mean going out for a walk. It might mean going out for a run. It might be doing something at home. But whatever it is, make sure that your body's getting some kind of physical movement. Make sure you're getting enough sleep. Sleep is so important. It's important to our immune system. It's important to our cognition. If you don't get enough rest, then you're going to compromise all kind of different aspects of your health. eating right now, eating's going to be difficult for all of us, and we may not get everything that we want, but continuing to eat as healthily as you can is going to be a really important part of staying healthy and well. And then finally, finding a sense of play in your life. In the middle of a global pandemic where so many people are suffering, and maybe people really, really close to you are suffering as well, play and a sense of joy can feel so far removed and perhaps even unnecessary in our life. But if we can find even a couple of moments in the day where we smile, maybe even laugh, find something that brings us a sense of joy, that has a very real impact, not just on our mind, but also on our body. So just making sure that you're looking after yourself. Remember, it's not selfish. It's not just for you. It also benefits the people around you as well.
Well, let's finish today with a light discussion and just thinking about your own wellness, right? So if you had a day off of work, just say you had a free day, or maybe you're not working outside of the home, but if you had a free day where you could only had to support your own wellness, where everybody else in your life is taken care of, what would you do on that day? What would you do for yourself? Put your thoughts in the chat. If you had a free day, oh, this one's going fast. Go fishing, play golf. Oh yeah, for sure. What else would you do? Read a book outside, read, nap, ride a bike, swim, nap in my hammock, go for a swim, bake my favorite treats, spa day, go out for a nice breakfast, and then find a great coffee shop that has fancy coffee, go for a walk, play video games, listen to music, go for a run, take the dog for a big walk, crafting, oh yeah, sit by the lake, for sure. There's so many things that when we stop to think about it, that things that can connect with us, with ourselves, where we feel more like us when we do these things. And so, somebody put play my piano, for sure. Often the things we connect to are creative, but sometimes it's about like, you know what I would do? I'm going to get that closet cleaned out. Whatever it is we need right now to take care of ourselves, to feel that we are more filled and more equipped and more ready to take on the challenges of the day. I want you to think about what you put there or what you thought about with this question. Oh, do a puzzle as well. Good. Bicycle ride. Excellent. Think about this question and go, is this something that I can maybe build into my week? This thing that I would do. I might not have a full day, but can I still put it in somewhere? Because what you selected might also tell you a little bit about maybe what you've been missing or some area that you might want to consider and put a little bit more time, resources, or supports around it. So that can happen for you. Thanks everybody for sharing. Speaking of supports, the resources that we talked about earlier, they're not just available to the other people that you care for, they're there for you as well. So the ability to recognize our needs and take time to reach out for supports is a strength that increases resilience and wellness. So feel free. You can also call 211 and just find out more information on what's available to you in your area. Now, if you would like to enhance your skills around providing immediate support to someone who is experiencing mental distress, we do encourage you to sign up for some additional learning around mental health or psychological first aid. The Mental Health Commission of Canada offers a variety of in-depth mental health first aid courses that discuss interventions for how to support individuals who may be experiencing a mental health crisis, such as suicidal thoughts or behaviors, panic attacks, overdoses, acute stress, psychotic episodes. So on their website, you can view the courses and see what's available in your area. And also the Canadian Red Cross offers different psychological first aid courses with the focus on building resiliency and establishing coping strategies. Alberta Health Services, which again, as Anissa mentioned, in addiction mental health is now going to be called Recovery Alberta. We also have some workshops on psychological first aid. So I think Anissa is going to put the links into the chat. And then you can click on those links and check out those things for more information where you can kind of go deeper in this idea of how we can support others who are having some mental health challenges. And with that, then I just wanted to say thank you so much for joining us today. If you would like to talk with someone about mental health or substance use, for someone you know or for yourself, we encourage you to reach out to the supports such as 211 Alberta for more information, or one of the helplines or programs that's listed here. And I just want to note out one point, I'll do a little shout out here. The Mental Health Foundation is a partner with Kickstand, and Kickstand Connect is an initiative for youth ages 12 to 25 and their families. And currently it offers virtual mental health support online, but it's going to be opening up a physical drop-in space at West Edmonton Mall in the fall. So that's something to watch, we're going to check out. But you can definitely call these numbers and they can definitely help you to find more supports that might be helpful to you and those you love.
Thank you so much, Anissa and Kathy. This was an excellent session. I took so many notes as always. So I would love to hear everyone's takeaways in the chat. What stood out to you in this presentation today? I'm assuming, a few things for all of us. I really loved, like some of those sample questions that you shared to check in with folks, ways to start the conversation. The reminder of, checking in with ourselves and then circling back to that step 6 of supporting our own wellness. I just think that's such a great, powerful reminder for all of us listening today. So yeah, I would love to hear everyone's takeaways. You can share in the chat. We also have the survey link that will be shared that you can share with us there as well. So I will go ahead and just share our final screen here. It's really just thank you everyone for attending. Thanks for those who joined our session today, whether you're here live or you're watching the replay. I saw some questions in the chat of people who wanted the presentation shared. So yes, we will be sharing the replay with everyone who registered, and we can include some of those just excellent resources that you shared as well with the direct links when we share that out. Thank you again to our platinum sponsor, Ellis Dawn, for being here today and making this session possible. As we teased at the beginning, our next Lunch and Learn will be on October 23rd, and the topic will be sleeping your way to better mental health. Our registration link just went live on our new registration platform, so you all are the first to hear about it today. So if you'd like to save your virtual seat, I will go ahead and paste the link in the chat. A few links for you all today. So the top of that one is, as I mentioned, the registration link to sign up for October's session. There's also a link there to sign up for our newsletter and or become a monthly donor to join our community that way. And then, of course, if you want to get in touch with us, there's our email address there, info@mentalhealthfoundation.ca. So as I mentioned, there'll be a short 5-question survey that will pop up as soon as this session ends. So please go ahead and share your feedback with us so we can continue to improve these sessions. And yeah, that's all we have for you today. So thank you again for joining us. Thank you again to Anissa and Kathy, our wonderful facilitators, as well as our platinum sponsor, Ellis Dawn. We hope to see you all again on October 23rd. Bye for now.